Hi, I'm Dr. Raymond Douglas of Beverly Hills, California, and today I'm going to talk a little bit about blepharoplasty, and especially male blepharoplasty. Now, it is true that most blepharoplasties are done for women, probably about 75%, but more and more men are looking to improve their appearance around the eyes, doing a blepharoplasty. Unfortunately, it's very common to know when a man has had a blepharoplasty because it's often overdone. And the most important aspects of performing blepharoplasty for men is to maintain that male masculinity. And this has to be done in a very different way than you would for a female blepharoplasty, where you want to augment the feminine curves and the feminine appearance of their eyes. For men have heavier eyebrows, so much less lifting of the eyebrows themselves, maybe a little bit of a lift, especially in the tail of the brow, but minimizing that as much as possible. This defines a male, rugged, and a very good feature for men's brows. For the upper eyelids, this means that you have to be very conservative in how much skin is removed. If you take away too much skin, it will result into a very hollow upper eyelid, and this becomes a very feminizing appearance. And there's many examples of this. Opening up any magazine will probably reveal them, but it really is a very unique art in doing a male blepharoplasty because you do not want to take away too much tissue, but still give that open-eyed appearance. The other thing is that we would not want to do too much ptosis surgery. And ptosis surgery is when the eyelid itself is drooping. A lot of times I have to improve the asymmetry and lift one eyelid, or maybe even both, because they're so droopy that it's either blocking vision or more commonly just not an attractive appearance. But for men especially, you only want to open the eyelid a little bit and not give a wide open, starey appearance. Otherwise, that becomes a very feminizing and non-masculine feature. The lower eyelids are also really important. Men tend to lose fat in their face, just like women, and they tend to get bulges of the lower eyelid, often just like women. But it's very important not to remove all the fat from a man and from his lower face, because men tend to have less cheek fat and tend to have a slightly more angular and rugged appearance to their cheek and jaw structure. So you want to maintain this. One of the ways is to do a blepharoplasty, where you take the fat and you roll it down onto the cheek and not remove it. This will avoid the hollowness. It's a little more technically challenging to do, but it'll really result in a much better improvement for men. You also want to be very careful of the lower eyelid position in men, because too low of a lower eyelid position and showing any white under the eye tends to look a little feminizing. And so being very careful of how much skin and how much fat are removed is really important. While these sound like minor differences, they really are major if you've ever seen poorly done blepharoplasty for men. So I think it's really important to see someone who does male blepharoplasty routinely and commonly and avoids these problems. Thank you very much, and we look forward to your comments below.